are welcome to Health Matters on Channels Television. It's good to be with you again to explore a topic that could affect your health. I am Mary Alale Yusuf. A fistula is an abnormal connection between two parts inside the body. Fistulas may develop between different organs, such as between the esophagus and the windpipe. They can also develop between two similar structures, such as between an artery and a vein, or between two arteries. The World Health Organization approximates that over 2 million women live with untreated obstetric fistula in Asia and sub-Saharan Africa, and that globally, 50,000 to 100,000 women develop obstetric fistula every year. Today, we concern ourselves with the obstetric fistula, and our guest on the show is Dr. Ayodeji Olamijulo, a consultant obstetrician and gynecologist at the Lagos University Teaching Hospital, Idi-Araba. You are welcome to the show, Doctor.
Thank you, Mary.
Now, we spoke about fistulas being connections between two parts inside the body. But what exactly is an obstetric fistula?
Thank you very much. You are quite correct with the definition of what a fistula is. And obstetric fistulae are the abnormal collections that arose or that have arisen as a result of obstetric accidents. As you know, in this part of the world, obstetric care is less than adequate. And because of that, you have issues with conditions like obstructed labor. And this may result in fistulation between, say, the bladder, which is in the urinary system, as well as the vagina, which is in the reproductive or the genital tract. So you then have a vesico-vaginal fistula. But obviously, you can also have connections, abnormal connections, between other elements that are similar to that, either between the rectum and the vagina. That will still qualify as an obstetric fistula. You can also, further up in the urinary tract, you can have an abnormal connection between the ureters. These are the pipes that bring urine into the bladder, and say the vagina, or you also have connection between the bladder and the uterus. So these, in a nutshell, are obstetric fistulae. But I think importantly is the consequences that matter. You know, what happens when you have this abnormal connection. Okay,
just a minute. I want to quickly ask you, there are some terms coming up here. What do you mean when you say obstructed labor?
Obstructed labor is one of the leading causes of maternal mortality in developing countries. It's in a situation where, as a result of neglect, labor becomes prolonged, and usually because the baby, especially the baby's head, is too large to go through the mother's pelvis.
The canal.
And yes.
Like we are seeing now.
That's right. So as a result of that, you find that instead of progress being made, labor becomes obstructed, which means that labor can no longer progress.
Okay, obstructed meaning it is stopped or it's prolonged?
It's prolonged and it's stuck.
Okay.
The labor is going nowhere unless there is some form of intervention.
Okay. So when that happens now, what exactly happens to the tissues of the woman? Do they cut? Do they break? What really happens there?
What usually happens is that the tissue, the soft tissue of the base of the bladder as well as the vagina becomes compressed.
Okay, that's about where we are seeing the baby's head now.
Yes. So you have compression of those soft tissues between the canal of the mother, which is bony, as well as the head of the baby, which is also made of bones. And therefore, with prolonged compression, and if the obstruction is not relieved, then what happens is that the tissue, the blood supply to the tissue becomes cut off.
Okay.
And the tissue then become devitalized and necrosed. In time, that breaks down and then a connection exists now where there was no connection.
Okay, a couple of minutes ago, we had another diagram up showing some pressure points there. But when you say necrosed, are you saying the tissue dies?
Yes, something like that.
The tissue dies.
Yes.
And because it has died, it becomes weak?
It becomes weak, and then with pressure from the filling bladder, there is a breakdown of the tissue there,
Okay.
and then that then establishes a connection, a hole, an abnormal hole where there was no hole before.
Either between the vagina and the rectum, or the vagina and the
bladder.
And the bladder.
Yes.
Or both?
Or both sometimes,
Okay.
yes.
I see. Now, is that the only cause? Could that be the only cause of an obstetric fistula?
It's not the only cause, but that is the commonest cause. There are other causes that can arise from obstetric injury, either from, say, complication of cesarean section, or when a woman has had a ruptured uterus, especially following a previous cesarean section where there has been scarring between the bladder as well as the vagina. And then there is a tearing, which, if not recognized and repaired, will lead to an abnormal connection. It can also occur if you have difficult forceps delivery, usually also in relation to prolonged labor. But there are other causes apart from the obstetric causes, of course. But by far the obstetric causes are the commonest in our environment. Elsewhere, you have surgical causes, such as following hysterectomy.
Okay, now, that's removal of the womb.
Yes, removal of the womb. The way to understand it is that these structures are neighbors. They are quite close to one another. And, either because of previous operations and distortion in the anatomy of the area, then unintended injury may occur to the bladder as well as the vagina, leading to a fistula. There are other causes in our environment as well, either because of harmful traditional practices, such as, the gishiri cut, which is commoner.
We'll come to that. But I want to ask you, this obstetric fistula, we call what we see usually in this country vesicovaginal fistula. Are we wrong in our nomenclature? Are we saying that it's obstetric fistula, both encompassing the connection between the vagina and the bladder and vagina and the rectum together, that we usually see in this country?
Well, obstetric fistula, these are descriptive terms. When you use the term obstetrics, then you are relating it to consequences of maternity accidents.
Okay.
Okay.
Whereas, but if it is by reason of a surgery,
yes, by reason of a surgery, again, there are obstetric surgeries. There are operations that are carried out in the pregnant situation, and there are other operations that are carried out in the non-pregnant situation. Gynecological operations. So that's the difference. Whereas one nomenclature is looking at whether this is something that has happened in relation to pregnancy. The other is looking at the anatomy, what connects to what.
Okay.
Is it the bladder connecting to the vagina, or is it the rectum connecting to the vagina, or is it the ureter that is connecting to the vagina?
Okay. We usually, when we hear of these cases, usually they involve little girls, young girls, almost children actually. But can this affect older people as well?
Yes, it can. You are right in saying that in most cases you find that this affect